under control. I must appeal to the public to remain vigilant. Please try to keep social distance as far as possible because that is an effective way in preventing infections. Dr. Chuang, we have 3 confirmed cases today. Cases number 1086, 1087, and 1088. All 3 are locally confirmed cases. 1068, female 40. That's one of the cases I mentioned yesterday. On the 7th of April, she started to have a low fever, cough, and sore throat. Between the 27th and the 29th of April, she went to see a private doctor, and the doctor considered her a case of upper respiratory infection. She and her husband and 3 children live in Kwai Lun Yut House of Kwai Lun Estate. The husband is not showing any symptoms. Other family members not showing symptoms either. From the 27th to the of April to the 7th of May, she did not go to work for the first few days. She was on sick leave, and then she took leave of her own to rest. Usually, she would go to the Kwai Shing East Market to buy groceries for cooking at home, and she didn't attend any particular gathering. But except that on the 28th of May, after work, she had dinner with her colleagues. 1087, a female, 36 years of age. She's the colleague of 1086. From the 25th of April, she started feeling unwell, a fever, sore throat, and so on. And then on 27th, she went to see a private doctor. She went on sick leave for a few days until the 30th, and she walked to work usually. Her job nature is similar to that of 1086. That is, they are in packaging of food or applying food labels and so on. She and her husband and son live in Lun Yut House in Kwai Lun Estate. She also likes to go to the Kwai Shing East Estate Market for her food shopping. And then 1088, man, 27 years of age, is an ambulance man. He's an ambulance man. He is asymptomatic. On the 30th of May, he he received a call from 1084 and sent her to the Prince of Wales Hospital on an ambulance. It was in the morning. And when they arrived, it was found that 1084 had a low oxygen content, so oxygen was administered to her. It was oxygen mask, which is a non-respirator. And then so on the ambulance, that's assistance given to her, and then he helped to monitor her symptoms and her readings. And after he sent this patient to the hospital at night, he went to dinner with his girlfriend in Kowloon Tong, the shopping mall, and he was a bit worried, and then he went to stay at a friend's place in King Yuen Estate. He didn't go home. Now, otherwise he lives in Fuk King House and Lake Yuen Estate with his parents and older brother. Now, after he learned that 1084 is a confirmed case, he's concerned, and so his superior arranged for him to do a test, and he was admitted to the Prince of Wales Hospital for doing the test. And when we found him, he was already in the Prince of Wales Hospital. As for his other colleagues, they tested negative, but he's a confirmed case today. So that means he tested positive. When he helped 1084 on the ambulance, he wore a surgical mask, goggle and gloves, but he didn't wear an N95 respirator. So perhaps he did not wear the full protective gear. So that's why he and his colleagues will be sent to the quarantine center. And now he's in the Prince of Wales Hospital to receive treatment. So far, he's not showing any symptoms. And then last night, we went to the Kerry warehouse in Kwai Chong. We collected some environmental samples. They all tested negative. And last night, new stock arrived, so we went back to the temperature controlled warehouse to collect some environmental samples from the packaging of vegetable and meat. We tried to see if we could find anything. We took 11 samples. They all tested negative. And then today we'll be writing to all doctors in Hong Kong. We remind them to pay attention to possible COVID-19 cases. If anyone shows symptoms, they should collect samples from the patients so we could rule out the possibility of COVID-19. And then as Dr. Choi reminded the public, we should also pay attention to our own health conditions. Sometimes, usually if you have a runny nose or you have a sore throat, you might not usually see a doctor. You think you could get well after resting, but perhaps now it's better to go to the doctor and leave a sample for testing. Because otherwise your condition may worsen or you may infect your family members. So that's all by way of report. Dr. Lau, good afternoon. As at noon today, in the past 24 hours, the hospital authority reported 18 cases, probable cases to the Department of Health, and there are other cases already in hospital. So in total, there are 66 patients still in hospital receiving treatment in isolation. In the past 24 hours, there was no discharge of confirmed patients. So far, 1,036 confirmed patients and 1 probable case were discharged. And then, including the 3 confirmed cases today, in total, there are 47 patients in 9 hospitals receiving treatment. 2 patients are in critical condition. That is case 595 in the Eastern Hospital and 1084, case 1084 in the Prince of Wales Hospital. There are no patients in serious condition. For the remaining 45 patients, their condition is stable. As at 9 a.m. today, the hospital authority has a total of 1,211 negative pressure beds, occupancy 41%. Negative pressure ward 541, occupancy 50+%. Okay, the floor is open to questions. Please identify yourself before you ask questions.
RTHK. First of all, about the ambulance man, you said that he wore gloves, eye covers, and also the surgical mask. Does that mean that for the frontline ambulance men and medical workers, the protection is not enough? Why didn't he wear N95 masks? Is it because the patient didn't explain her condition clearly to him, or was it just because the ambulance man was not properly protected? So, would you ask the frontline healthcare workers be asked to wear I-95? And also, you said you collected environmental samples from the warehouse, and the packaged food tested negative. So does that mean that we can rule out the possibility that the virus came from the goods? And also, what is the source of the cluster? Can you tell us the progress of the investigation? And also, for private doctors, you can see that in yesterday's case, she went to the doctor for several times, and yet no sample from her was taken. So did the same thing happen to today's confirmed cases, that they saw a doctor and yet no testing was done? Would you make it mandatory for private doctors to do testing of their saliva or the deep throat saliva samples? As for the ambulance man, when he arrived to take the patient to the hospital, and then he actually administered oxygen treatment to the patient, and he also used a special kind of mask for the provision of oxygen to the patient. And there's a risk involved in that process. So he might have needed to wear protective gear to ward off airborne transmission for safety purpose. So he should have worn N95 to carry out the process. But it all depends on the 5 services department's guidelines. And the department has always monitor the situation of providing ambulance service and would make amendments or changes if required. As for the food warehouse, earlier on, we went there and we could not collect the chilled food, packaged chilled food. And we could only wait till when they have the food arrive late at night before they were sent to the market the next morning. So we knew about the arrival of the new food packages coming. So we took samples from them and see if there's any trace of contamination. And no samples tested positive, no evidence then that they have been contaminated. But well, we of course, if we couldn't find any evidence, we still can't rule out the possibility. It's just that so far we don't have the evidence to show any contamination happened. But we would issue letters to all private doctors, asking them, encouraging them to test patients with symptoms so as to rule out any possibility of COVID-19. I'd just like to supplement here. The last question about private doctors, taking samples from patients. You all know that throughout the past months, the government has been, as I said in the beginning, it has tried to actually carry out testing and collect samples from various individuals to confirm a case or even to have testing for suspected cases for all kinds of people, like those arriving back into Hong Kong or people with symptoms in the community, or even lately, even asymptomatic individuals. They would be screened and tested. But let me stress that for most clinical tests, they had to be explained by the doctor to the patient first, and we need to get the doctors needed to get a consent of the patients. And as a result of the latest case, I hope that the public and private doctors should know there are cases where symptoms could be very mild in the very beginning. So if at an earlier stage the patient or the doctor can be more vigilant and carry out testing, then that can effectively have early detection of the case and isolate and treat the patient concerned at an early stage. And that could help definitely stop transmission in the community. And also when the patient, often at an early stage, they only have very mild symptoms, but when the disease remains untreated, situation could get worse. And the latest case is an example showing you what could happen. So early detection, early treatment is very, very useful for the patient. So I'd like to remind you that whether it's doctors or patients, they should, in trying to stop the transmission of COVID-19, they can play a role. And I will call on and remind private doctors to play the role, and patients should not just to try to take a chance. And when they feel unwell, they should see a doctor and take the initiative of asking for testing. Next question, please, lady there. TVB. I'd like to ask you, is it the first time where ambulance men contracted the virus while on duty? And often when they receive a call, they wouldn't know whether it's a suspected case or not. So when they provide the service, the patient may not have the symptom of upper respiratory tract infection. So is there any necessary necessity to amend the guideline for tightening up the protection? Do they face a similar risk as healthcare workers? And Hong Kong has seen the clusters of infection. So is the government prepared to tighten the gathering bans, or, for example, extending the gathering ban as a result? As far as I know, he was the first ambulance man who, because of work, contracted the virus. But let me remind you again that the testing of the ambulance man showed that the virus load was quite low. So for someone with early symptoms, you may thing. Well, usually I would expect the virus load to be high, but in his case, the city value is only 36, is on the low side. So we found it quite strange, but maybe being asymptomatic is the reason. But maybe he had been contacted earlier on. So we need to do more testing to find out the exact reason. We may take blood samples from him to see whether he had antibodies within his body already, and we also find out whether he had contact with other infected cases. I know that the Fire Services Department, if they have any doubts, once the staff have any doubts about the nature of the cases, the staff is supposed to wear protective gear, like gloves and so forth, and masks and so forth. And after the latest case, they may have to see whether there's a need to amend their guidelines.
On the various regulations enacted by the administration in response to the epidemic, it is means to reduce the risk of transmission through legislation. For example, at eating establishments, there are certain rules, there is a cap on the capacity, and there are certain precaution measures which must be taken to reduce the risk of transmission. And then at the scheduled premises, we decide if they could be open for business, and if so, what precautions they must take. And then we have gathering bans, with restrictions on number of people that can gather in public places and so on. But then, of course, the epidemic, was in a state of flux. In March, April, we had a large number of, in fact, imported cases, so the healthcare system was under immense pressure. But in the past months or so, we have seen imported cases coming from other places, but the number is much smaller. And then for about 2 or 3 weeks on one occasion, and on this occasion about 2 weeks, we did not have any local cases. In between, we had just small cluster of local cases. So for the regulations enacted by the administration and the directions arising from these regulations, they are in response to the developments of epidemic, as well as the needs of the people, such as economic activities, the need to go to school and so on. So we try to strike a balance among all these factors. Now, this time we're seeing local cluster again. This is an alarm bell to us. As the WHO and other experts have been saying, this epidemic may become a new normal for us. So maybe we cannot expect that there won't be any local cases in the near term. We must be adequately prepared mentally, and we must have enough vigilance that there could be more local cases. So we must start from personal hygiene. We must wear a mask properly. We must review our own personal hygiene practices. And also, we keep reviewing all the measures covering, say, the eating establishments or the 10-plus scheduled premises. We also been monitoring measures on gathering restrictions. All these measures are meant to protect the public from a point of view of public health. So as these regulations or directions are about to expire, we will make an announcement in a timely manner. Thank you. The one in red, please. Dr. Cui, Dr. Ho Pak Leung suggested that we need to wear a mask indoor, and then we could remove the gathering restriction. As for it's rather outdoor. We could remove the gathering ban, and indoor, as long as people wear masks, you could keep the ban. So would you consider it? Would you be extending the gathering restriction for another 14 days because they're due to expire soon? And there are close contacts that have to be quarantined. What about those working at the Kerry warehouse? How many need to be quarantined, and how many have been tested, and what are the test results? And then for Luen Yut House and Kwai Luen Estate and Lake Yuen Estate, how many specimen bottles have you given out? How many samples have you collected? Now, you said you've collected environmental samples. They all tested negative. But where did you collect these samples? Just now, the reporter asked about the gathering restrictions. For all the regulations we put in place, they are based on public health considerations. So if there are more people gathering at the same place for a long period, or if they may become less vigilant, say in an activity like they may take off their masks, or they will be chatting happily, or there may be a large number of people gathering, and then people become less vigilant, then these such scenarios are still high risk scenarios, and we have to pay attention to that. Now, in our regulations, sometimes the directions are valid for a week, others are valid for 2 weeks. This will allow the government time to conduct timely review of the situation, and then we decide whether to relax or not relax certain measures and how we relax those measures. Now, for the gathering restriction, if the epidemic situation is such that is fine for us to adjust the size of the gathering, we'll do so. Now, of course, we're still seeing changes in the development of the epidemic, and when these regulations are about to expire, then we'll make an announcement in a timely manner. Now, we collected environmental samples from spots where there would be more people touching those spots, such as their computer, keys, desktop surface, wash basins, the taps, and so on. And at night, we also collected the packing of the food items. So we collected, in the first round, we collected 20 samples, and then last time we collected 11 samples. So altogether, we collected 31 samples. They all tested negative. There are now about 30 plus close contacts in this cluster. They are being sent to quarantine centers. From Lake Yuen Estate, we received 600 plus samples. From Kwai Lun Estate, we collected some 400 samples. We are still handing out some specimen bottles. Maybe there will be another 1,000 bottles, but we're still distributing them. We haven't finished. Well, yesterday we mentioned that there are 12 medical or healthcare workers involved in the urgent treatment of the patient. There's one doctor, one nurse, one patient assistant. They've been sent to the quarantine center. So far, there are 11 healthcare workers, including the 3 in quarantine centers, who have been tested for COVID-19. They've all tested negative. And then there's one nurse working in a triage station of the accident and emergency department. Well, because she hasn't come back to work yet, so when she comes into to work, then we will do a test and we'll announce the results when it's out. Thank you. The one in white, please. I'm from Now. Dr. Choi. For the Guangdong, Macau, and Hong Kong quarantine bans that's due to expire on the 7th of June. So now that we have local cases there, we need to extend the ban. And what about the joint prevention and control mechanism for the 3 places? What is the latest status? For the 2 Kerry workers, they went to see a private doctor. Which clinic is it? For the paramedic, how many patients did they come into contact with after the patient? And are you able to trace all those patients? About the movements of people among the 3 places, we are still following our strategy. That is, when the epidemic is at a certain stage, we may start to review essential travels among the 3 places. So that's the consideration, and then maybe there is necessary that we could put in place certain measures that are considered workable by the 3 places. Now, some time ago, the epidemic eased to a certain level. It was an appropriate time to review such measures. We are actively working on that. So we'll see where it's feasible and where we have the administrative support measures in place. Then we could allow people to travel between the two places because of work or for other needs. But of course, there must be a system that is reassuring to both sides. So when the administrative system is worked out, then we will make an announcement. For the two private doctors, they are in Kwai Chung. One's practice is in Kwai Fong Road. The other is in Kwai Shing East Estate. For the paramedic, who might have been in contact with other patients, we're still tracing that. The one in black, please. I'm from Ming Pao. First of all, 1086 and 1087. So those are the two who tested the weak positive yesterday, right? And do you think they are the source of this cluster in your initial assessment? Now they went to see a private doctor. Did they receive any deep throat saliva test, or did they ask for the test, or did the doctor suggest a test? Now, for these few cases, they've all been to private doctors for some time. Their cases were only discovered now. So does it mean that your strategy to appeal to private doctors to actively arrange for tests is not working? Maybe there's a loophole here. Maybe there could be other measures to require private doctors to do the test. Otherwise, it will be considered professional misconduct. Would you consider something like that? Third question about the ambulance man. Now, he could have been infected because of work. So what about this legislative amendment to the occupational disease legislation? There's been no progress for several months. So if there are more cases like this, shouldn't you speed up that legislative amendment exercise? Now, we cannot be sure. Yes, these were the two cases that we mentioned yesterday, that they tested weak positive, but are they really the sources of the infection? Well, we're still doing investigation on that. On the question of testing, now, at the beginning of the epidemic, that is end of January or early February, there were cases. And the patients went to see a doctor several times, and the cases were only confirmed subsequently. Now, what is important is that all doctors have a high degree of awareness. They must be very vigilant, and that's important. That's why the Department of Health has been reminding healthcare workers repeatedly that they have a role to first to help with the identification of the disease. Now, some patients may have really mild symptoms. It would be just like a mild cold or flu. So that's why the practitioners must be vigilant. Is important. That's a second thing is about the patient. Sometimes it may not be the doctor who did suggest a test, but maybe the patient thinks that the condition is too mild. The patient chooses not to see a doctor. The patient just chooses to buy over-the-counter medication. So that's why there's no test. Now, if I've explained, for clinical tests, the doctors must explain very clearly the test to the patients, and the patients have to give consent to do the test. So on this basis, I hope from this cluster we will realize this. That is, when a patient goes to a clinic and says that he or she may have upper respiratory infection, they display certain symptoms, then the private doctors must take the initiative to suggest a test. But then the patient is himself or herself also has duty here. That is, they must go. Patients must go and see a doctor early, so to prevent their condition from worsening. Now, on occupational disease, under the Employees Compensation Ordinance, there is provision that if an employee is infected, although this is not scheduled occupational disease, but then if the employee is infected or is injured at work, the scope is wide there. Or the employee is injured could cover, disease, and then the employee could seek compensation from the employer. So the protection is there. But of course, the Revenue Department, that is the Labor Department, will continue to consider this matter. What about deep throat saliva sample? Sorry, speakers not using microphone. I think the doctor did not suggest a test, and the patient did not ask for a test. The lady over there.
Morning Post. So a few questions. First of all, regarding the ambulance man. So currently, what are the ideas? Like, how was he exactly infected? Was he infected by the 34-year-old woman, or possibly through the living environment? Because Dr. Chuang, you mentioned that he actually also stayed in Lek Yuen Estate as well. And would the CHP actually advise the Fire Services Department to revise its protective gears guideline for ambulance staff? And also, does the health authorities have any fear of if there is any outbreak in Lek Yuen Estate or Kowloon Luen Estates, as there are like a few cases staying in these two estates? And also, regarding the source of infection in the warehouse, so some of the experts said that actually the virus could be spread through the traces left on the food packaging. So actually, would the CHP also take any new measures or revise any guidelines for the industry when handling imported goods? And finally, with the emergence of locally infected cases, actually would the government further extend the gathering restriction, which is actually set to expire after June 4th? Thank you.
I think the source of infection of the ambulance man is still under investigation. He has an obvious contact with 1084. That's why we know that he's a known contact with 1084. He also recalled he had accompanied another case on 29th of May, but at that time he accompanied the case from the Chunyang Estate to PWH with full PPE without any high-risk procedure. So we consider the risk for that occasion is very small. But is there any other possibility that he might have contacted previously? We are still investigating. So I don't think there's a outbreak in Lek Yuen Estate at the moment, because the two cases in Lek Yuen are couples, and this one has a known contact with the case. So there's no other cases yet in the Lek Yuen Estate at the moment. For the warehouse, I understand there's a hypothesis. That's why we also took samples from the packaging last night, from the food packaging, and we have not found any positive result at the moment, so we have no evidence to sustain this hypothesis at the moment.
The government has enacted a few regulations to assist the prevention of spread of this viral disease. So one of them is the Prevention Control of Disease Prohibition on Group Gathering Regulation. And of course, we introduced this regulation at the peak of the outbreak in Hong Kong around March, but as the outbreak trend show a decreasing trend, so the government decided that the instructions under the regulation can have some modification of details, so that whether it's on the business premises and also gathering might be adjusted to match the situation of the outbreak in Hong Kong. So I think the government is ready to modify all the details in these different regulations or instructions to match with the local situation. Of course, as the number of local cases has diminished but not yet disappeared. As you can all see, there are at least two local clusters in the past 5 weeks. So we have to remain cautious, but yet we have to balance the need of the society and also the need for people to work or to go to school. So we have to keep a very fine balance. So the government is looking at how to adjust the details of these regulation and direction very closely, and we'll announce the details in due course. Thank you.
Cable TV. I'd like to ask about the warehouse, the cluster, the source of infection at the cluster there. Even though you couldn't find the evidence from the environmental samples, look at 1086 and 1087. They have been contaminated before. Case of 1084. What is their virus load? Is it the higher chance that because they both went to market in Kaohsiung East and they lived in Kaohsiung Estate, is it possible for them to have been contracted the virus in the community and then spread it in the warehouse? Or do you think they contracted the virus from the food packaging before spreading in the community? And my other question is about private doctors. Now, more and more private doctors have discovered, it's found that they have seen patients and yet did not give them the bottles to collect their saliva samples. So could you, besides giving an appeal to them, make it mandatory and create a deterrent effect for them to ask the patients to be tested? The doctor in Lake Yun Chun and Estate is still seeing patients today, and yet, they may not, and the doctor may not have informed the patients today that he had seen an infected case. So, do you think that he should have actually had his clinic clean and closed for 14 days? And also, for the case of the ambulance man, is it possible that he had accompanied people who had returned to Hong Kong from abroad, like Pakistan, and cases who have been confirmed, and maybe he had accompanied these people to the hospital? And about the wearing of N95, is it the guideline for the Fire Service Department to ask them that when they are providing oxygen supply, they don't have to wear N95 or what? As for the warehouse cluster, we are carrying out an investigation from various angles. The two patients developed symptoms in late April. How do they contract the virus? There are all sorts of possibilities. So in Kwai Lun house, we are in the house there. We had distributed the bottles to collect saliva samples, and also the Kaohsiung East Estate Market. We also send the bottles there to the shop owners to see where there are any possible sources of contamination. So the investigation is ongoing. As for private doctors, we hope that they can be more vigilant. As Dr. Choi just said, they can make their own clinical judgment, and they need to be more alert so that actually maybe they became less vigilant because the number of local cases went down earlier on. As for the ambulance man, initially we know that on May 29, on that day, the day when there were 13 cases, he had accompanied a case going from Zhongyang Estate to Prince of Wales Hospital. But back then, he was wearing fully protective clothing, and he had no contact with oxygen or not administering oxygen supply or providing any first aid. So we consider that to be a low-risk contact. But the Fire Services Department's guidelines, I know the guidelines were made with reference to other places, so they would see whether there's a need to revisit those guidelines. As for testing, we agree that in any circumstance, if testing can be done, that would certainly help with controlling the epidemic. But our objective remains that, the patient has to provide a sample and have the sample delivered to the laboratory. If we were to use tougher methods to increase the rate, then it's not just about distributing bottles alone. The patient has to cooperate and be willing to deliver the samples back to the laboratory first. So the entire process has to be enhanced, and we'll see how we can improve the process more, and the private doctors can cooperate more. And now we've seen a recent cluster with various patients who had seen private doctors, and it seemed that the doctors involved and the patients were not as vigilant as they should. So I hope that the latest cluster will remind private doctors to be more vigilant. Not just one or two doctors, but all private doctors, private hospitals, or doctors operating in a private environment to be more vigilant, particularly for patients with very mild symptoms. Sometimes they may not want to go to a A&E immediately. They may want to contact a doctor they're familiar with first. As I said, there are about 7,000 private doctors in Hong Kong. That's a big network that can actually help us identify patients with early symptoms. So I think that if we all work together and be vigilant and propose to the patients to be tested, and if the public can cooperate to leave samples, and that will help the situation.
I'm from Hong Kong 01. Now, for the three paramedics, after they came into contact with 1084, did they go back to the ambulance station? How many calls did they go on that day? Is it a case that for all working at the ambulance station, they had to be quarantined? Now, you said for the paramedic who went to a restaurant in a festival walk, and so what's the name of that restaurant? And then, well, the girlfriend, is she in quarantine? And then third question is about the protective gear. Now, many ambulance paramedics said that when they receive calls, they are not told whether the patient shows any respiratory symptoms, so they don't wear the protective gear. So how can you make sure there is sufficient information given to the paramedics so they could be they could gear up before they go and take the patients? Now, for the three patients, we're still following up on whether they have close contact. For 1088, the friend having dinner with him and the friend's place, and that he stayed at, both friends didn't show any symptoms that they were sent to quarantine center. As for the fire services department's guidelines, I think you have to ask them. What about the name of the restaurant? It's called Ao Gok. That's a Japanese restaurant. Okay, two more questions, perhaps.
The paramedic who was infected after handling the 34-year-old woman. I know that the case is still under investigation, but can you clarify how likely do you think that he was infected by the woman? And could he be the first paramedic to be infected by a COVID-19 virus patient? And also, there are two other cases linked to the woman. So could this woman be a super spreader potentially? And also, about the private clinic's practice, the 30-year-old woman had been to a private clinic in Sha Tin a couple of times before she tested positive for the virus. But the clinic, according to the report, is still open today, and they also didn't provide the COVID-19 test for the patient. So, do you see that as a problem, and do you consider these as loopholes or inadequacies that the government needs to fix? And thirdly, Dr. Choi, you talked about the need for extending the social distancing measures. You said that there may be sporadic cases in the future. So do you think it's sensible or proper to continue extending these social distancing measures, including the gathering ban, given that like whenever there is a local case, because you said there has been sporadic cases, so should we just keep on extending the social distancing measures? Also, is there a need to extend the gathering ban that will expire on June 4th? Thank you.
I think the exact source of infection for the ambulance man 1088 is still being under investigation. he has contact with 1084 on 30th of May, but he is asymptomatic at the moment. So after checking his virus load, I think the CT value is very high. So we are not sure whether he's recently infected or he had been infected by other source a while ago. So I understand the hospital will take some blood for the antibody test just to check. So if he already has antibody, so he's not likely to be infected by 1084. Maybe there are other sources of infection for him. But I mean, this is still not conclusive. As for whether 1084 is a super spreader, I think his husband is probably infected by him. But the two colleagues probably is who had earlier onset of symptoms. So the two probably were not infected by this patient. So we cannot conclude whether she spreads for a few patients at the moment. So I understand the clinic has been advised for disinfection and cleansing and reopened. But after considering the infection risk for this woman, because he has quite high viral load, and also number 1088 has been infected. It's like one of the possibility is he get the infection from this woman. So we have put the clinic doctor and the staff under quarantine.
好，嗰位
The government has established different channels in enhancing the testing for asymptomatic individuals in the community. For example, through the hospital authority where patients can attend accident and emergency department, and also the general outpatient clinic for consultation and a test. And of course, in this community setting, private doctors play a significant role because there are a large number of private doctors in the market. According to the registry, there's maybe close to 7,000 doctors working in the private sector. So if they can be vigilant enough and also offering tests for patients who attend their clinic presenting with respiratory symptoms or mild symptoms that is suggestive of COVID-19, then of course that will become a very extensive network to facilitate community testing. So I think at this stage we are calling for the cooperation, awareness, cooperation, and also vigilance for all private doctors, because they have a role, definitely a role to play in doing early testing. And of course, we also would like to call for the alertness and also cooperation of citizens in general, because many of them, when they suffer from very mild illness, they may choose not to go to a doctor. But now, as we can see, there's still sporadic local cases and also potential local clusters, because we don't know yet how extensive is this current cluster. So we need time to establish, and we cannot predict which local case can become a bigger local cluster. Because of that potential risk, I think citizens should be also very alert to attending doctors if they have a respiratory symptom or even very mild symptoms, and proactively discuss with the doctor in charge for whether they need the test. And regarding all the regulations concerning controlling or restricting social distance, implementing social distancing measure in preventing the spread of disease, I think the government has not stopped in reviewing all the existing regulations in place. So, and also under those regulations, we have issued time-based instructions, whether in a 2-week period or 1-week period, adjusting the details according to the situation of the outbreak. So the government will continue to do so and announce the latest situation as soon as possible.
好，嗰位男士。
The gentleman over there, please. I'm from Hong Kong Economic Times. For the few warehouse employees, they went to see private doctors. Is there a high chance of infection? And those private doctors, after seeing the patients, the confirmed patients, did they see any other patients? Is there need to do contact tracing? And then second question is for chilled food, the factories where overseas that supply the chill food, do they have employees with infections? Thank you. Now, in the past, we would have about 1,000 patients. We have so far about 1,000 patients. Many of them have seen private doctors. Every time we'd ask whether they've been to see a private doctor, and we'll ask the private doctor what the protective gear was that they were wearing and what was the contact like. Was it just for a short time? Did the doctors carry out any examinations, and were those high-risk examinations and so on? And of course, we would also ask the patient at the time whether there were other patients waiting together. If everyone was wearing a mask and they didn't have any contact really, then usually these are not considered close contacts. Usually, private doctors would have taken all precautionary measures. So that's why very often there's no need to consider them close contacts and quarantine them. So far, we have not seen any private doctors being quarantined as a result of that. You overseas employees, you mean? Those factories that supply the chill food, would they have workers infected in those factories? Well, we haven't got that information. We've not heard about that. Now, whether in those overseas places, they did any tests or they did any investigation, or whether there's an outbreak or not, that could be a factor to consider. There's one more question. Preliminary confirmed cases. We don't have any today. Okay, that's the end of the press conference. Thank you.